Hello, my name is Natalie Turner and I am a third-year OSU internal medicine resident. The title of my QI project is Anal Pap Screening and Follow-Up in the OSU IMSS Clinic. Anal Pap screening is a minimally invasive in-office method we can do to identify dysplasia or abnormal cells, as HIV positive individuals are at an increased risk for anal intraepithelial neoplasia, also known as AIN. This project concludes a two-phase longitudinal design, with phase one looking at data acquired last year that established a baseline screening rate of 41.6% that showed 363 out of 873 males undergoing screening with either an anal pap smear or four-quadrant biopsy. Of those 363 males, 124 of them were identified to have AIN1 or greater. With this quality improvement project, I looked at follow-up patterns among patients with AIN1 or greater to assess their dysplasia over time. So phase two looked at the continuity of the 124 patients who were diagnosed with AIN1 or greater and looked at whether the patients were lost to follow-up or, if they were compliant, looked at histological changes to determine if regression, stability, or progression occurred. With this screening, we are able to identify high-risk patients effectively, one of those being a case of invasive squamous cell carcinoma that was identified on initial screening test. While it is great that 55% of patients achieved histological regression of their dysplasia, our follow-up failure rate of 51.6% is the primary limitation that leads me to our next steps. Future efforts must focus on patient navigation and reminders to include visual flyer reminders that can be placed throughout the clinic, not only for patients, but for providers as well. Dedicated screening visits to discuss just anal pap smear screening, as well as vaccinations, with most importantly, the HPV vaccine, and expanding all of this even further next year to base it off of updated guidelines. This project highlights that even small system-level changes in screening and follow-up can lead to meaningful improvements in early detection and long-term patient health.